We've now had about 3 years of experience of using pirfenidone and about a year of using nintedanib, and although the drugs are not miraculous, they are certainly a big advantage compared to previous medication. Both pirfenidone and nintedanib seem to have a similar benefit in reducing the rate of decline of lung function in IPF. Both of the drugs are similarly priced at around £25,000 a year and have side effects. We were quite concerned about the side effects when we first started using the drugs, but we're now learning how to advise patients to minimise these. The common side effects of pirfenidone are feeling off food and losing weight, and also something called photosensitivity. Although one takes pirfenidone for its effect on the lungs, taking the tablet by mouth will mean that the drug goes into all parts of the body, including the skin. The drug absorbs ultraviolet light, and this can make people sensitive to the effects of too much sunlight, and this can cause a nasty rash. Photosensitivity can be minimised by covering up in the sun and also using factor 50 sunblock, and in fact exposure just to ambient light can cause the problem, so patients need to be careful. Nintedanib can cause diarrhea, although we've not seen this to be too much of a problem. One potential problem with nintedanib is a perceived problem with bleeding. Because of the mechanism of action, there is some feeling that nintedanib may have effect on blood vessel formation and predispose people to bleeding. For this reason, patients who were already taking blood thinners were excluded from the original drug trials, and for that reason we often try to avoid nintedanib when patients are on blood thinners such as warfarin.